As we all know, health is a big component of what affects the people of Kenya. We have committed ourselves jointly between the national government and the counties on collaborating on this very important subject that is otherwise devolved to the counties, but that requires our collaboration and working together, because matters health are very serious. We all know statistics show that close to 1 million people every year go into bankruptcy because of hospital bills. We also know that we spend a significant portion of our budgets, especially the counties, on matters health. And we as a nation, we've been trying to resolve this jigsaw around health for the last almost 15 years. I remember in the Grand Coalition government when Professor Anyang' Nyong'o was our Minister for Health, we had a go at it. We had a go again when Charity Ngilu was Minister for Health. We again tried with the Jubilee administration in 2017, 18, 20. And we ran into a lot of difficulties. I remember one of the counties that was the pilot was Nyeri, and we ran into a lot of problems. And we had to announce that this thing has failed. So and it was something that I was very passionate about, because if we can solve this question of health, then we will have solved one of the very big problems we've always had as a country. All of you remember that the many Harambes we used to hold in the past was for school fees. But after what we did around education, that problem there are no more Harambes anymore about school fees. They are very, very exceptional situations. The only problem that we still have is Harambes around matters health. And that is why it is important for us to solve this health puzzle. And it requires the concerted effort of all of us. I remember very clearly asking Mahmoud here to be the chair of NHIF, because I wanted to do some work around it. And he did a wonderful job in NHIF. But we couldn't get it quite to the place where we wanted it to be. And learning from the experiences of what we did in a Grand Coalition government, what we did as the Jubilee administration, we've gathered a body of experience on how not to do it. You know, they say, when somebody tries to do something, if he succeeds, he achieves what he's doing. If he fails, at least he has one lesson, how not to do it. Like, for example, just listening to what we have been talking about here, what kind of communication are we going to be giving to our Ngao and CHPs? Why should a Kenyan register? Yeah? We need to be clear why they should register. They should register so that each one of us can access health. For those who can afford, then they will be in the scheme. For those who you need to register, so that if you cannot afford, the government can then budget to pay for you. That's why you need to register. You need to register because when your child goes to school, we want every child covered. We want every child's medical attention to be provided. But you have to register so that your child is captured. You know, by registering, you will register together with your family. And then, so that when your child goes to school, they are in the system for them to be covered by government and by the health services that we are providing. So we need to be basic but very clear so that people know why they have to register. The people in energy and the people in ICT, those hospitals that have no electricity will not be able to run some of the facilities. Many facilities require energy. So where there is no electricity, we are asking the Ministry of Energy to provide solar connection. Where there is no internet, because we are now going to deliver this on a digital platform. Where there is no internet, let us use satellite to make sure that we deliver internet in those areas so that every part of Kenya is covered. For all the other departments that are supposed to play a role, go out of your way. You know, the Ministry of Education should mobilize students so that they become part of the registration process and making sure that we don't leave nobody behind. So, indigents, Ministry of Finance, begin to internalize what is the budget outlay, what are the priority areas, what do we need when, so that we can provide for that service. The people in citizen services, all people traveling to Kenya must be covered, so that the health insurance cover for people traveling to Kenya, which is already in the ecosystem, should now be brought into place, so that if any person traveling in Kenya becomes sick or get involved in an accident, there is a mechanism for them to be treated without necessarily as incurring unnecessary expenses. They should be able to be covered by the cover they are going to get. So this is a whole of government approach. I'm very happy with the progress that has been made, but it is not done until it is done. And 1st of October, it is.